stronger, more resilient Ontario, a stronger and more resilient Canada. All of the provinces and territories are making unprecedented investments in healthcare. Ontario is putting over $67 billion towards healthcare this year and $4.8 billion for long-term care. But it's not enough to keep up with the growing demand. We need the federal government to step up. Right now, the federal government is only contributing 1/5 of the bill for healthcare. Not long ago, healthcare was a 50-50 partnership. Today, healthcare costs are rising by 6%, compounded year after year, and the federal transfers for healthcare are growing by only half that rate. That's not sustainable. So I'm standing with my fellow premiers, and we're asking Ottawa to come to the table now to increase their contribution to Canada Health Transfer to 35% share of the provincial spending. Because as the numbers keep rising, we have to respond quickly and decisively, and there's no time to waste. We also need the federal government's help when it comes to strengthening our long-term care system. We need immediately and ongoing supports for long-term care residents and those who care for them. This means recruiting and hiring more staff, enhancing infection prevention and control, and building 30,000 new beds over the next decade with better ventilation and more private rooms. These are critical investments that need to be made now. On another front, Ottawa needs to play a more active role on testing and enforcing quarantine at the border. We also need them to expedite approvals for rapid testing options. This means more testing at the borders, sharing data and information quickly, and making sure travelers are acting responsibly, especially now with the case numbers on the rise. Finally, we need the federal government to step up with more infrastructure dollars to support economic recovery. That means investing $10 billion each year over the next decade in infrastructure across the country. We have 4 subway projects for the GTA that will support over 22,000 jobs and reduce carbon emissions by over 1 million tons. And with the current challenges, we also need access to high-speed internet and reliable cellular service in more communities across the province, better internet for schools, businesses, and families, so they can adapt and stay connected during these unprecedented times. And I will be looking to the federal government to address these critical priorities in their upcoming throne speech, because the threat of a second wave, addressing surgical backlogs, ending hallway healthcare, and building more long-term care beds for our seniors, these are critical challenges, and we're doing our part here in Ontario. This week, Minister Elliott and I will be sharing the details of our fall preparedness plan. But we need Ottawa's support, and we need it now. Let's give Ontarians, let's give Canadians the confidence that they can count on their healthcare system when they need it most. And that we'll all get through this together. Thank you, and God bless the people of Ontario. Now I'll take questions.
You'll go to the first question.
Your first question comes from Miranda Anthistle with Global News. Please go ahead.
Hi, Premier. Happy Monday. Hi. So speaking about that plan, you said it will be released later this week. So can you just expand upon that? I know that Minister Elliott said earlier during question period that, the second wave plan parts that are already being implemented. So can we just hear more about this plan and which parts have already been implemented?
Sure, Randy. I'll hand it over to Minister Elliott. Thank you.
Thank you. We do have a complete and comprehensive fall preparedness plan that we are going to start bringing forward tomorrow for discussion and to let people know what we have been planning for some months now. We have been enhancing testing, and that's one element. We have increased our tests. We've reached 25,000 per day on a regular basis. On Saturday, we reached 40,000 tests in one day, which is a record for Ontario, well on our way to being able to conduct 50,000 tests per day. Because, of course, along with that, though, you have to have the lab capacity, because the testing is only the specimen collection, so to speak. Then you have to have the specimens tested in the lab. So at the same time we're increasing the testing capability, we're increasing the lab capacity as well. But this is a very comprehensive plan. This is going to be brought forward over several days because there are many elements to each section of the plan, and we certainly look forward to sharing that with all Ontarians.
Follow up.
And this is a question for the Premier. There's labor negotiations going on right now between the Ford Car Company and its main union. And the midnight deadline is for tonight. And the federal government has said it is willing to invest $500 million to bring electric vehicle production to the Ford plant in Oakville specifically. But it does say that it also needs money from the province. So I'm wondering, how much is your government willing to invest to bring this technology and electric vehicle production to Oakville?
Well, I can tell you that we can't talk about this until the negotiations are over. There's active negotiations happening right now between Unifor and Ford Motor Company. But what I can tell you is how important the automotive industry. It's one of the most important industries in all of Ontario, not just the plants themselves, but which is even larger than the plants are all the part manufacturers that we have across Ontario. They represent in excess of over 100,000 people, and that plays a critical role as well. But moving forward with Ford, I had a good conversation with the CEO late last week, and I really focused on, I think this is great if we're able to move forward and have this plant expand here in Oakville, but the parts are very important. We would like to manufacture the batteries here rather than bringing the batteries in from out of country. We have the capabilities, we have the raw materials here. So why can't we produce the batteries? That's my big ask to Ford, and hopefully these negotiations will go well tonight with Unifor, and we're there to support both Ford and Unifor to get this past the finish line. But we'll be in there for the investment.
Next question.
Your next question comes from Sean Jeffords with the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. I wanted to follow up on details of the plan coming tomorrow. I'm wondering why it's taken the province so long to unveil this plan if, as the minister said this morning, elements of it are already being implemented. Yeah. What's holding things up here?
Well, I'm going to pass it over to the minister, but you have to understand, Sean, I think I know you understand and everyone else understands. What happened in March is different than what happened in July. What's happening in July is different in September, and we have a solid plan. There are a lot of items have already been implemented, but this is fluid. This is moving day by day by day. Things are changing day by day, and a perfect example is on a Friday, there's no lineups, and all of a sudden on a Monday, we see a spike in cases, and there are lineups everywhere. And but I can tell you one thing: the minister has been working around the clock and is doing an incredible job on the fall plan. But I'll pass it over to the minister.
Well, we have been working for several months developing the fall plan on the understanding that it is going to be more difficult to deal with than the first wave for several reasons. One is that we also are encountering the start of flu season as well. And there have been thousands of procedures and surgeries that were canceled during wave one that we don't want to cancel again. We want to make sure those surgeries and procedures can continue because families need to have this done. Individuals need to have this done. I've heard from many people about what children with special needs that need surgeries and need help are going through. We cannot let that happen. So that we have had to be extra careful in building in those protections and taking all of those issues into consideration. We've also asked for a lot of money to be able to do this, both from the federal government and internally. And everyone has needed to do their due diligence with hundreds of millions of dollars being at stake here. And we have to work with the federal government to make sure that they are going to be able to release their funds in a timely manner to support those areas that we have really focused on, being testing, lab capacity, and making sure that we're ready for the flu. So all of these things are coming together, but we have been implementing them. We've been building upon the base since the beginning with testing. For example, we started with 5,000 tests per day. Now we're at 40,000, moving to 50,000. So we're increasing the investments that we're making and building up to a potential wave, a large wave in wave two. We have planned for the worst and are ready for it, and everything else in between. So we are ready to go. And as I said, we are looking forward to sharing this plan with the people of Ontario.
Follow up.
Follow up for the minister and for Dr. Yaffe as well. Given the long waits that we're seeing at testing centers across the province, should the government be changing its messaging regarding testing and telling people specifically if they don't have COVID symptoms or a specific exposure that they're aware of, that they shouldn't be getting a test right now because they should be allowing access for people who do have symptoms at assessment centers?
I'll pass it over to the minister, then over to Dr. Yaffe. Thank you.
Well, we certainly want everyone who is concerned about COVID-19 to be able to have the test. And so we have people that are experiencing some symptoms. It doesn't matter what it is, but if they're not feeling well, we want them to feel that they can go for a test, and that if they feel that they've been associated with someone with COVID. However, we are also looking at expanding the scope at our assessment centers, allowing them to have longer hours. We've set up some pop-up testing facilities in the area where the longest lineups are happening, but we're also looking at other groups, for example, pharmacies, to be able to do testing, and that would probably be an appropriate place to send people who are asymptomatic, worried about their situation, but not necessarily exhibiting symptoms. And so those are all the elements that we're looking at so that everyone who wants to get a test will be able to get a test.
Next question.
Your next question comes from
Sorry,
Mike Crawley.
sorry, hold.
Yes, hi. With respect to testing, obviously there are certain groups that are particularly high priority, people with symptoms, and we're continually reviewing which symptoms are the important ones because there are so many symptoms, which ones are more important than others or more indicative of COVID than others. We're also obviously contacts of cases. If you've been notified by a health department that you've been in contact with a case or through the COVID alert app that you've been in contact, that is high priority. You're part of an outbreak. You're in a vulnerable setting or you're a vulnerable population member. I want to emphasize though that I know, testing is important, but it is not the be all and end all. The most important thing for people to remember is we want to prevent infection. And how do you prevent infection? Don't go out if you're sick, first of all, so you don't spread it. Wash your hands frequently. Wear a mask if you're not going to be able to stay more than 2 meters away from other people. And I think people have been letting their guard down. There has been some complacency, particularly we've seen over 50% of our cases now are in the 20 to 39 age group. People are going out with friends. They're not wearing a mask. They think, oh, it's my friend. They must be okay. They're in groups. We've reduced the social gathering size, but still people, they go out to an event, they sit down to eat. Obviously, you can't wear your mask. You have to stay at least 2 meters away from people at that point, unless they're in your social circle. So those are the things that we have to keep in everyone's mind, top priority. Thanks.
Next question.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Mike.
Hi, Premier Ford. While you've reduced the limit on social gatherings, there are a lot of cases that are developing, just as Dr. Yaffe just said, from things that are not parties. What actions are you looking at taking now or in the next few days to further clamp down? Because the numbers that we're seeing now are similar to what it was back when the province was at stage 2.
Well, before I pass it to Dr. Yaffe, Mike, I think making sure we get the message out consistently, making sure people don't let their guard down, don't take the eye off the ball. This is active, this is moving, and it's moving at a rapid pace. And we have to acknowledge that. And, concerning things like the big car rally in Ancaster, we can't let that happen. We can't let our guard down and just continuously message. I always say, Mike, you can't turn on the television, you can't turn on the radio, you can't look at the newspaper, you can't go out and talk to your friends without talking about COVID. And everyone knows the procedures. You just have to follow them and not let your guard down at all. I'll pass to Dr. Yaffe.
Thanks. So right now we see about 75% of the cases are in Toronto, Peel, and Ottawa, but we are seeing increases in other health units across the province. So everybody needs to keep their guard up. Those same things I just said. Stay home if you're sick. Wash your hands frequently. Wear a mask if you're within 2 meters of anybody that's not in your social circle. Those are what's important. As well, we are very closely monitoring the cases, the outbreaks in different settings, and looking at what actions need to be taken at different levels so that we can try and reduce the spread of the infection while minimizing any unintended impacts of the measures that we're taking. So not jumping right back to stage 2, but looking at specific settings and saying, should we be changing the measures we're taking, for example, in long-term care or retirement homes? What should we be doing specific to different sectors and different regions? So we're extremely cognizant of the numbers, the data, keeping in touch with the local medical officers of health, and our public health measures team is working very actively at looking at what should be done to mitigate the spread of this infection.
Follow-up?
And this question is for Minister Elliott from my colleague Lauren Pelly. Pediatricians in the province are expecting that they're going to see higher than normal demand for the flu shot this season, and they want to see more support to be able to operate flu shot clinics in a safe way. What is the province going to do to help out?
Well, it is really important that as many people as possible receive the flu vaccine. We had a huge year last year. Over 4.4 million Ontarians were vaccinated, but we want it even higher this year, and that's for both adults and children. And so we are allowing the pharmacies are able to administer flu vaccines, although not to very young children. They will still need to be administered in their physician's offices. But this is important for entire families to receive the flu vaccine so we can prevent the transmission. But we are anticipating that if everyone continues to follow the same public health measures as they are to prevent the transmission of COVID, this should help the transmission of flu as well, with maintaining physical distancing, wearing a mask if you're not able to do that, washing hands frequently, and of course, staying home if you're ill.
Next question?
Your next question comes from Lucas Meyer with News Talk 1010. Please go ahead.
Hi, Lucas.
Hi, Premier. Thank you very much. Premier, I do think we should drill back on what Sean and the first question was about with regards to timing. I think most people can recognize that, things that happen in March and April are very different than what happened in August and September. But you did know that kids were going to be going back to school. You did know that people are going to be going back to work. And you also knew that you have to get a negative result back before you can go, re-enter those particular places. So I think it's a fair question to ask.
Sure.
Why are we only seeing the release of the plan now, at least on the testing side? Are you saying it's inevitable that we got to this point, that there was no way that we could have had the version of the plan with regards to testing before school started? Was that just an impossibility?
Well, as you know, we have the highest number of tests in the entire country, so it's been working. The plan's been implemented. The testing's moving forward. Let me just give you a little background on this. If you remember, back in March, we had 3,000, 4,000, 5,000. We've ramped up to 40,000 tests a day, heading up towards 50,000. Just to put that into perspective for the people at home, we're doing more testing here in Ontario than every province combined in the entire country. We're only 38% of the population, but we're hammering out the testing. We're getting every single area involved. We're making sure that we have enough reagents, making sure we have enough swabs. We're making sure that we've ramped up all the hospitals for extended hours, putting mobile testing units across the province, working with pharmacies, and hopefully we'll have up to 60 pharmacies by the end of the week up and going, and then they're just going to continue ramping up. So this is all taking place very rapidly. all over a 7 to 10 day period. So I think we're doing fabulous. I want to give a shout out to Matt Anderson and Dr. Dirk and public health. Everyone has pitched in. So I think we're doing an incredible job on testing. Where I'm always concerned, and we're ramping up every resource there is lab testing. As we go up with the testing, physical testing, we want to make sure lab capacity keeps up. We've reached out to every single university that has a lab. We're reaching out to the private sector labs, maxing out on public health, and we're needing support from Health Canada, not Health Canada, the federal testing. So trust me when I say all hands on deck, and the numbers show for it. If I were sitting here and we were still doing 20,000, I'd be concerned. We're ramping it up like we've never seen before in this country. Matter of fact, other premiers are asking us how we're getting the numbers up so quickly.
Follow up.
I understand that, Premier, but as you just said, you just mentioned what we're seeing in the last 7 to 9 days.
Yep.
And so my question is that what we're seeing in the last 7 to 9 days? Could this have only happened now? Was the long lineups that we're seeing now at the assessment centers, the fact that Alberta has asymptomatic testing since June, but we still don't have it, it's supposed to be rolling out now. My question is, was there any way in your mind that what we're seeing now could have been avoided, or was this going to be the situation the whole time?
Well, again, I'm going to just refresh your memory here. We had testing centers that people were standing around doing absolutely nothing. People weren't getting tested. I remember down in Windsor, Essex, we had to close a testing facility because no one was showing up. The resources were just sitting there. I would drive by Women's College every single morning, and there's 1 or 2 people in the line. I drive down now, which is great. People are coming to get tested. So when everything hit, we went from Friday under 100 cases, 10 days ago, and all of a sudden, bingo, overnight, people were lining up. I think that's great. And we reacted. And the numbers show how we reacted. We're increasing testing in a massive, massive way. And, it's not me. I don't need the credit. I don't. But the people out there doing the testing, the docs and the nurses and the Matt Andersons, Ontario Health and Public Health, they get the credit because we went literally from overnight, from roughly 22, 25, hovering right up to 40,000 in less than 7 days. So these guys deserve the credit. They've done an incredible job. They really have. And we're going to continue ramping it up.
Next question.
Your next question comes from Grace Macaluso with Automotive News Canada. Please go ahead.
Thank you. I have a question for the Premier, a question and supplementary about the future of auto assembly at Ford's Oakville plant.
Yep.
In the past, each level of government has contributed about 10% toward an automaker's investment. Ottawa's $500 million offer exceeds that threshold. Is Ontario prepared to exceed its traditional 10% contribution toward an automaker's investment?
Well, I'm not going to get into the weeds about what we're contributing and what we aren't, but we're at the table as we speak. I've had conversations in the automotive sector, and I think you know firsthand how big of a supporter this government's been to the auto part manufacturers and also for the automotive manufacturers. We're always going to be there. I think it's one of the most important sectors that we have here in Ontario, and we need to keep it strong. We need to be competitive. Everyone has to pitch in. The auto manufacturers have to pitch in. Unifor has to pitch in. Federal and provincial governments have to pitch in. That's the winning formula right there. When we all pitch in and we support each other, then we're going to have a thriving auto part manufacturers along with the automotive manufacturing sector. So I'm always supportive of the automotive sector. And I always will be.
Follow up.
Okay, and I have a supplementary. You said earlier that EV parts such as batteries should be built in Ontario, and you've had conversations last week with Ford CEO Dean Stoneley.
Yep.
Is the lack of an EV parts supply chain a concern for the automaker and a possible obstacle toward investing in EV production in Oakville?
Well, what I understand it is, but I think if we all work together, we can get over those hurdles. We can manufacture every other part. We have the lithium, we have the nickel, we have the raw materials that go into the batteries. We need to manufacture it here. Not to mention the JIT system that's in place just for the folks at home. It's just in time delivery. Do you want to be hauling these batteries from a southern US state up to Canada? Or do you want the batteries manufactured down the street that we can ship over in hours and you're saving millions of dollars on shipping? These batteries aren't as light as feathers, as we all know. They're big, they're heavy, and it's going to cost any automotive manufacturer, no matter if it's the Fords or Toyotas or Hondas or Chryslers. We want to manufacture here. We want to keep the jobs here. That's what we want to do. We're contributing towards this plant. We're contributing a massive amount at the end of the day once we get through these negotiations. I want the battery manufacturing done here. It's as simple as that. We can outproduce anyone. We can produce a better battery, better people, and a better product at the end of the day. We're the best in the world right here in Ontario.
The last question.
Your final question comes from Randy Rath with CHCH-TV. Please go ahead.
Hi, Randy.
Hi, Premier.
How you doing?
I'm wondering about this car rally with over 1,000 people at it in Ancaster on Saturday night. It seems that there's a hardcore of people that just simply don't think that the rules apply to them.
Yeah.
Is there anything more that the province can do to try and impress upon people that are just ignoring the rules, that the rules are very important?
So, Randy, full disclosure, I love vintage cars. I love the souped up cars. I was at a car rally about a month ago delivering funds that we raised with probably close to 1,000 cars going down to sick kids. But, you know, after we put out the guidelines and after we set the protocol and we see a second wave, and then all of a sudden we hear what's happening. They gather, these organizers. And as for the organizers, you know something, guys, I don't get it. I just don't get it. If we weren't so backlogged on MRIs, I'd send you to the MRI to get your brain scanned, because I don't think there's anything in there. We get the protocols out there, and they just blatantly ignore the people. You've got to really wonder. But these are people that I connect with. I go to these car shows. I connect with them. So, you know, the organizers, by the way, just FYI, you know, they're going to look for you. They're going to get you. Had an opportunity to talk to the Hamilton Chief Police, and just an FYI, they have 30 days to scan your license plate and go present one of those big, nice fat checks of $10,000 for you. And if that doesn't sink in, you have too much money. But even forget the $10,000. You're putting people's lives in jeopardy. You have 1,000 people. And by the way, Randy, this wasn't a show and shine. So everyone knows what a show and shine is. They get these beautiful cars during the day. Everyone looks at them. This was at nighttime. You can't see the cars. And what they do, and you can go on the internet and see it, they'll block off the highway, and then they start doing drag racing and start doing donuts in the middle of the highway. Like, you got to be kidding me. I'll tell you, if they had brains, it'd be dangerous, not to mention behind a wheel. It's unbelievable. So guys, get your act together. I'll tell you, it's just unbelievable. But, you know, they'll track them down as sure as I'm standing here, and I'll let the police address the rest of the issues.
Follow up.
I also wanted to ask you what you thought of the appalling treatment that our reporter received while she was there. A very talented young woman who had obscenities screeched at her constantly when she was there by some in the crowd, not everyone. Some members in that crowd were acting in a way that is frankly appalling.
It is appalling, Randy. You're going after there. Someone's reporting, and to bully a woman, you even bully a man, bully a woman. You guys are tough guys. You're unbelievable. That is weak cowards. You know, get your act together. And how about, I'm sure, I'll guarantee you, a lot of them have mothers and fathers. A lot of them have grandparents. Do you care about them? Then get your act together. It's very simple. It can't be tolerated. And to go and treat a reporter like that, it's unbelievable. And then the resources, that the tens of thousands of dollars we had to pull in from all different units across the province, the OPP, York region, we had Halton region. So God forbid something else is happening. Someone needs the police. They're busy chasing guys that want to be reckless and do drag racing down a highway or do donuts. And this doesn't represent, I want to say something to the public. This does not represent the person that brings their cars to the show and shine. They're good, responsible taxpayers. They love cars. You know, I love them. That doesn't represent them. You get a few yahoos, as I call them, out there wanting to be big tough guys and closing down highways and doing donuts to impress your girlfriend. You gotta be kidding me. You got to be kidding me.
Okay, thank you.
Okay, thanks so much. Thank you.